Good afternoon, one and all. My name is Dr. Hadidja Hassane. I just completed my M.Pharm Pharmaceutical Technology at Karnataka College of Pharmacy under the Rajiv Gandhi University of Health Science. Today, my topic is on breast cancer. We know that cancer it is a dreadful disease. 80 to 90% of cancer, it is the result of the thing that we do to ourselves. So, among women, breast cancer is the second most common cancer, which is the most malignant condition of the breasts. So this malignant, it's a growth of the cell which grow harmfully and uncontrollably in the breast. So what are the risk factors that's causing this breast cancer? First of all, it has to be a female gender, and has to be like the age has to be more than 50 years. But also, it doesn't mean when you are lower than 50 years, you cannot have this breast cancer. So it can be like when you reach in your 30s or when you are below 12 years. And this breast cancer mostly happen when you are in your postmenopausal, like more than 55 years. When you have a history of breast cancer, like when you have this hyperplasia, atopic hyperplasia, it is another factor. Consumption of alcohol. You know, when you are consuming every day 3 to 4, glass of alcohol, you are exposing of having 32% of, you are exposing yourself to have this breast cancer. You are in 32% of having this breast cancer. Or if you are consuming more than four glasses in a day, you are already in a class of 46% of having this breast cancer. People who are having overweight, obesity people, but mostly when they are postmenopausal. The kids, when you are in your young age and you expose your chest in radiation, mostly in hospital, it is another factor. Consumption of hormonal therapy, like when a woman, you go and you use this estrogen plus progesterone hormones, or you use estrogen alone, it is another factor. Oral contraception can be also another factor. Now, family history, when you have a family history also, like 10% of patients who are having this breast cancer can be as a family history, which is a mutation in the tumor suppression gene. So these are the factors that a woman can get breast cancer when he's having 1 or 2 or 3 of these factors. Like if he's exposing himself in these factors. What are the signs and symptoms to know that you are having this breast cancer, or maybe you may have this breast cancer when you have those signs? First of all, if you are more than 50 years or 40 years, you do this mammogram test. Mostly if they find some abnormal cells, it can be a sign. Secondly, when your breasts have become like a firm mass, like thick, okay, it can be a sign. So the changes of the breast can be thick, it can be deepening, or it can be redness. It can change the color. Okay, it can change the color. It can have these veins on the breasts. It can have some veins, can be visible, those veins. Or it can change in the nipples. It can change the morphology. It can go like inversion, like it can go inside, or the nipple can be, restriction. It can become thin. Okay, those are signs of having breast cancer. Okay, and also you can have the changes of the nipples. The changes of the nipple, there are three factors that you can see in your nipples. It can be ulceration, means you have this some wound in your nipple, okay? And you can have this inversion of the nipple, means that instead of the nipple to be out, it can go inside, or it can be tightening, all right? But mostly a woman in the nipples can have some discharge. This discharge can come out, or when you press it, some abnormal discharge can come out. So those are signs and symptoms, like you may have this breast cancer. When you have those signs, you have directly to consult the doctor. So what is a small history about this breast cancer? Breast cancer, you cannot just know it immediately. It takes like 5 years, okay, for the tumor to be palpable. 5 years, it will be there, develop slowly, till 5 years, at that time the tumor will become palpable. So where are the sites, where are the common sites where these tumor cells can be located? Mostly when you see your breast, okay, there are 5 sites. It can be the outer, okay, it can be the upper outer square, or it can be the upper inner square, or it can be the lower outer square, or the lower inner square, or the center. So most of people are having this breast cancer, it will start from the outer, okay, outer upper square, from here. Or people, it will come in the center, where there is the nipples. Or then it will come, they will find here, or it will come to the lower outer or the lower inner. These are the 5 sites where this tumor can, can be presented. Most of the people who are having this cancer. So, how the breast cancer can spread? When you already have the breast cancer, it can spread from the carcinoma or the sarcoma. Those are the tissue cells, or the organ cell, or the bones, or muscle. It can spread from those cells, okay? So now, how to, when you are already having this sign or symptom, what to do when you go to the hospital? What are the workout? First of all, they have to do the clinical, they have to do full clinical or family history. They have to take all your family history. So they have to do like physical examination, like they have to check the size, okay, because if this is abnormal, this one will be big and this one will be small. They have to check the size, they have to check the morphology, they have to take the thickness, okay, they have to take the discharge on the nipples, they have to check the edema, whether there is some swelling of your nipples or your breast. They have to check all those physical examination. And then you have to do some MRI, you have to do some ultrasound and biopsy to check, the hormones, the estrogen or the progesterone receptor status. They have to do some CT scan for your chest or your abdomen or your pelvis all together. They have to do mammogram test, but mammogram, it is reserved only the people who are more than 40 years, okay? So they have to do lab test as well, like a CBC. They have to do this general chemistry test, and they have to do this LFT. All those tests, they have to be done just to determine whether you are having the breast cancer or not. So now, how to prevent this breast cancer? Since we already talked about the factor, so to prevent breast cancer, first of all, you have to do self-examination. Women, all women, has to do self-examination. How this self-examination is done? First of all, when you are in the shower, you are naked, you examine yourself with your 3 finger, 4 finger together. You touch your breast on top, like circularly. Whoever want to know, he can also contact me, no problem. But he has to test himself, in a circular manner. And he has to go out and stand in a mirror, checking himself also, herself. She has to check properly, and also she has to lay down again to check. If she find some places where there is some cyst or some small thickness or something hard, okay, she can also consult the doctor to make sure that there is no problem. That is called self-examination, okay? And to prevent himself, he has to control his body weight, Okay, he has to do some regular exercise. He has to prevent himself of consuming alcohol. Some limitation has to be there. I'm not saying not to consume alcohol, but it's better to stop or put some limitation in alcohol consumption. Or we have to prevent ourselves of exposing ourselves in radiation, mostly going to hospital unnecessarily, doing this chest MRI or X-ray, something like that. We have to prevent only whenever it is necessary to do those chest or MRI. And we have to stop induced abortion. Abortion is also another factor. We have to prevent doing abortion. Okay, and then we have to give ourselves, we have to nourish our body with a proper diet. We have to consume more vegetables. We have to eat nice fish. We have to consume eggs. We have to eat these soya beans nicely. So those type of healthy food, it will help to remove those dead cells or harmful cells in our body. So now, I can conclude my topic by saying, because I know my topic is very large, but I don't have much time to explain everything. So whoever has any sign or persistent sign and symptoms about whatever I have been talking here, to present herself to the doctor and do those screening tests that I talk about, because in the world, breast cancer has been found to be 1.7 million in a year, even more. It's increasing every year. Okay, cases are recording every year. But we can thank our medical researcher or medical care for their effort and improvement in the science. Now, the survival rate, it is varying depending of nations. Okay, it's vary, but worldwide still survivors are more. So whoever has any history background or who has persistent sign and symptom, please, women, don't feel ashamed. Present yourself and do this screening test. Check yourself, okay? Because early stages of breast cancer or located of breast cancer, like we know the sites where these tumors are present, it is easy to diagnose, okay, rather than late stage of breast cancer. So myself, I always say, prevention is better than cure. Thank you.
Yes, the moment was just great and amazing, and I know that you have enjoyed it too. So don't forget to subscribe and click also on the bell button so that you can receive all the notifications of our YouTube page. And don't forget to share and to comment also.